Hey, how are you? Okay, well, today we are going to present the work that the group of Juan Falcon in Bilbao, in Spain, in Cibiogune, is performing regarding glioblastoma in the framework of a European project, IBIGLIO, funded by AERA-PERMET call. Okay, the work is trying to set up a flow cytometry analysis of cell-free nucleic acid DNA. In glioblastoma is a disease. I mean, it's the most common tumoral brain that is in humans, and also is one of the most severe and difficult to detect because there is no markers, non-invasive marker, and the way to detecting is normally when you have already a big tumor more than 2 millimeter normally in the brain. So we need to have novel biomarkers, preferable in plasma, in order to detect it easily or more quickly, and also in order to follow the disease, the treatment of the disease. Because when you have a treatment and it's not working, if we know rapidly, we can change this treatment and then trying to improve the prognosis and the disease of the patients. So what we have tried in the laboratory is to using flow cytometer and knowing also that the previous works in different groups showing that maybe in glioblastoma the circulating nucleic acid is higher in the patients. Okay, we thought, okay, let's try to by flow cytometer with dyes that can detect specifically nucleic acid, detect these nucleic acid associated vesicles in circulation. So the methodology is we split in two parts. One is more setting the real conditions to be sure that what we are detecting are the nucleic acid in circulation, and then apply to the sample of the of the patients. So in order to set the condition, we choose one cell line that is a glioblastoma cell line, that is the U87. Okay, so what we have done is to condition immediate by the cell, doing size exclusion chromatography in order to purify the vesicles and then analyze by Bradford and nanosite and then cryo-electron microscopy, doing all this kind of characterization. Okay. And then with a marker, with a label that is specifically for, I mean, in theory it was specifically for RNA, but in the practice, this pyronin Y detect both DNA and RNA. So at the end, we choose this as a global nucleic acid detector by flow cytometer. Okay, but this is more or less the scheme that we follow. So samples that we purify by sec, then we label with the pyronin, and then we go to the flow cytometer to do the analysis of the samples. So these are what I mentioned before, the U87 extracellular vesicle, okay? You can see here the size exclusion chromatography, the 12 samples, and then how the CD63 and the flotilin and CD81 and CD9 marker of vesicles are all of them in the part that has to be with the vesicular part. Similar with the nanosite we have here, and you can see here the Bradford, how the fraction with the more proteins are more in the from the 7 to the 6 to the 12. Okay, so the system is working. We are purifying vesicle from the U87. Now, in fact, we look by electron microscopy and we can see here. Now we see by all this fraction, we staining with the pyronin, and we can see like a fraction 3, 4, 5 is the one that has more of the staining. So in correlation with the presence of more vesicular part there. So we have vesicle stained with pyronine, so indicating that we are detecting the nucleic acid associated vesicle. Importantly, here you have the quantification of the fractions, and also when we combine the three fraction that has the vesicle and we do dilution, serial dilution, we can see how the detection of the pyronine is linear. So that means that we are not having like a swarm effect or this type of thing. So that is very important when you are working with flow cytometer and vesicle, to show that the dilution, serial dilution, is a linear of the detection that you are follow. Okay. So then what we have done is to let's see how much is protected or the associate to the vesicle. For example, here we have the treatment with DNAs, treatment with RNAs, and the treatment with both DNAs and RNAs. And you can see here how when the treatment will reduce the signal, but still we have a lot of signal remaining that we consider that is associated to the vesicles. So these are free nucleic acid in the purification of vesicle that we have, or free or associated to the surface, okay, that is able to be degraded by the DNAs or RNAs. And then all of these are protected. So this will be considered inside the vesicle. Okay, so the protocol is working. So now we start with the plasma. In this case, healthy individuals. Okay, let's see, we purify the plasma by size exclusion chromatography again, and we combine in this case, the control, okay, then with the DNAs, RNAs, and both. And you can see how we have some signal that are reducing, but still we have a lot of signal associated to the vesicles, okay? This is the vesicle purified by size exclusion, okay, in this case, but also we can go directly to the plasma. And this is this other part of the vesicle. And similarly, we can detect some signal associated to pyronine positive signal associated to the plasma. And this is the good thing. And then we go to the patient's samples, and here again we can see how the sample from, in this case, we go directly to the plasma, because as we already saw that we can detect it directly without purify the vesicle, we go directly to them. So as you can see here, we analyze 14 control some plasma from healthy healthy individuals, and from 15 glioblastoma patient plasma. As you can see, we are able, by this methodology that we develop, staining 1 milliliter of plasma with the pyronine sample, with the pyronine compound, and go to the flow cytometer. During 30 seconds of detection, we can determine that in the case of the control, we have very low abundance of pyronine positive signals. However, in the case of the glioblastoma, we were able to see a lot of patients with the glioblastoma. So that means that the protocol, easy protocol, because we have this, the plasma, and directly we do the staining with the pyronine, and we go directly to the flow cytometer. We are able to detect pyronine positive signal that are more abundant in the plasma of patients. So, and with that, I think just the conclusion that with this pyronine Y staining, we are able to detect nucleic acid associated to the vesicles by non-conventional flow cytometer, by the Cytoflex staining. Then we also are able to detect in plasma directly, and we obtain that the plasma samples from glioblastoma patients show a distinct nucleic acid pattern, and this is a good to continue with them. We acknowledge the funding of this project, and also the collaborators from that has participated from the RNet permit. Okay, these are the two references that can be useful for in one of them. The most of these results are public. So, and with this, I hope that this project has been good for you. Okay, thank you very much for your attention.